Hi, it's Dr. Centeno, and today we're going to talk about what is an upper cervical workup. We use that term a lot, and I want to relay what it means to us so that you have some idea, if we're talking about this, what it means to you. So, how does this help us diagnose craniocervical instability? As you probably know, I'm out for 6 weeks, but I've prepared 5 lectures on CCI topics that will be on YouTube and Facebook Live Fridays at 1 p.m. MST, 3 p.m. EST. So make sure to tune in. So what are the basic elements of a craniocervical instability diagnosis? Many patients think it's just my imaging shows that some number is off or measurement is off, hence I must have CCI. And regrettably, it's not that simple. It requires us to look at your history, for instance, how you got CCI, either trauma or hypermobility. Your symptoms, do your symptoms make sense? What we would expect for CCI? Obviously the imaging. And then do you have typical responses to treatment? So for example, does the cervical collar help? Does active physical therapy make it worse? Upper cervical chiropractic makes it better, those sorts of things. Does your physical hands-on exam look like you have CCI? And then are other possible causes for your symptoms ruled out? So this is what we use. You've probably seen this before. So what happens when the diagnosis of CCI is less sure? When we're just not certain that all of those pieces of the puzzle match up, then we move forward with what we call an upper cervical workup. So what is that? It means treating the upper cervical spine to determine if the patient responds to treatment. So let's say your main symptoms are head pressure and visual symptoms. Well, if we treat your upper neck and the structures there that usually cause those, upper neck facet joints, irritated nerves, etc., then do those symptoms get better even temporarily? If they do, then we have a lot more confidence that your upper neck is the cause of this, and you may well have craniocervical instability. And if they don't, then we need to discuss what we want to do in moving forward. So what's usually done in an upper cervical workup? Well, there's a hands-on exam so that we can try to determine whether or not you look like other patients who have CCI. And then again, after that, we can go ahead and use usually platelet-rich plasma or other platelet products to treat the posterior ligaments, the upper neck joints, irritated occipital, and other nerves to try to see if you will get better by treating the upper neck. So why don't we just accept another physician's diagnosis of CCI? Well, as you've probably seen in other lectures I've given while I'm out, most metrics being used by surgeons aren't tested against how prevalent that finding is in normal control patients. And surgical standards are heavily focused on fixing distances and angles that are found on imaging and less focused on fixing symptoms. So in summary, we use an upper cervical workup to help decide if a patient has symptomatic CCI. Many of these patients move on to the PICL once we really figure that out. But some of these patients fall out of our system because we're just not sure that they have CCI causing their symptoms. And again, you want us to make sure that you have CCI causing your symptoms, because if you don't and we try to treat it, you're not going to get any better. So thanks so much for watching, and have